Imagine for a second that you are looking at a 35-year-old, and maybe it's a friend, a colleague, or maybe it's the person you see in the mirror every morning. And this person does everything right. They hit the gym a few times a week, they skip dessert more often than not, and they feel absolutely fine. Invincible. Even they are in the prime of their life, building a career, maybe, raising a young family, and then without a single second of warning, they collapse. No chest clutching, no dramatic gasp, just lights out. By the time they hit the floor, their life has effectively paused and the clock has started ticking on whether they will ever wake up again. This isn't a scene from a medical drama. This is the new reality of heart health in 2026. And it is happening to people younger and younger every single day. We used to think of heart disease as a grandpa problem, something you worry about when you retire. But the data we are seeing now from major institutions like Northwestern Medicine and the University of Oklahoma is showing us a terrifying shift. Heart attacks in people under 40 are rising, and for many, the very first symptom of heart disease is sudden death. If you are watching this, you probably care about your health or you care deeply about someone else's. So I need you to do something for me right now. If you want to know how to protect yourself and your family from this invisible threat, just hit that like button or subscribe. It helps us get this life-saving information to more people who might be walking around with a ticking clock and have no idea. I also want to be incredibly clear with you from the start. I am sharing this with you because the game has changed, but I am not your personal doctor. Everything we are going to talk about today is based on the absolute latest guidelines from the American Heart Association, the American College of Cardiology, and peer-reviewed research up to 2026. I have listed every single one of those authentic sources in the description below so you can verify them yourself. My goal is to give you the tools to have a smarter, life-saving conversation with your own medical team. So let's strip away the jargon and talk about what is actually happening inside those arteries. Because what you learned 10 years ago is probably wrong. We all grew up with the plumbing analogy, right? The idea that your arteries are like kitchen pipes and cholesterol is like grease that slowly builds up and the pipe is 100% clogged. And while that makes sense, it's actually not what kills most people. Suddenly, if your artery slowly closes up over years, your heart is smart. It builds little detour vessels called collaterals to get blood around the blockage. That causes chest pain, sure, but it rarely causes that sudden drop-dead heart attack. And the real killer is what we call soft plaque. Think of it less like a clogged pipe and more like a pimple inside the wall of your artery, a little pocket of cholesterol and inflammation sitting under a microscopically thin layer of skin. It might only block 30% of the blood flow. And so you would never feel it on a run and you'd pass a stress test with flying colors. But if that thin skin pops, maybe from high blood pressure, stress, or high sugar, it's like a volcano erupting. When that soft plaque ruptures, your body panics. It thinks you're bleeding, so it sends clotting factors to the scene instantly. Within seconds, a massive blood clot forms to seal the wound, but instead, it seals the entire artery. That is how someone goes from perfectly healthy to a massive heart attack in the blink of an eye. It's not the slow clog, it's the sudden rupture. Now, you might be thinking, I eat well, my cholesterol is fine, so I'm safe. And this is where the biggest blind spot in modern medicine comes in. There is a genetic marker that up to 20% of the population carries, and most standard checkups never even look for it. And it's called lipoprotein A, or little a for short. Imagine your standard bad cholesterol. LDL is like a beach ball floating through your blood. LPA is that same beach ball, but it has a sticky, prickly tail attached to it. This tail makes it a triple threat. First, it's more likely to get stuck in your artery wall. Second, it carries inflammatory chemicals that irritate the artery. And third, and this is the scary part, that tail looks exactly like a clotting protein. It prevents your body from breaking down clots naturally. Because LPA is genetic, you can diet or exercise your way out of it. You could be a marathon runner with 6% body fat and still have dangerously high levels. And the tragedy is that we see families where a grandfather died at 45 and a father at 50, and the son is now 40 and worried, yet nobody ever ran this simple blood test. The guidelines in 2026 are clear. Every adult should test for LPA at least once in their life. Just once. If it's high, you have to be aggressive with everything else. We also need to talk about what it feels like when things go wrong, because the movies have lied to us. We've all seen the Hollywood heart attack. The man clutches his chest, grimaces, and falls over. Yes, that happens. But for women, and increasingly for younger people, the signs are much more subtle. And that's why they get missed until it's too late. For many women, the pain isn't a crushing weight on the chest. It might feel like a burning indigestion that antacids won't fix. It might be a sharp pain between the shoulder blades or jaw pain that radiates up the neck. But the number one symptom women report weeks before an event is an overwhelming, unusual fatigue. I'm talking about feeling like you've run a marathon when all you did was make the bed. And for men in their 30s and 40s, there's an early warning sign that almost no one talks about because it's embarrassing. Erectile dysfunction. The arteries down there are tiny, much smaller than the ones in your heart. And so if plaque is building up, it often clogs those small vessels first, years before it hits the heart. And it's not just a performance issue, it's a vascular barometer. If things aren't working right, is not just stress. It might be your heart trying to send you a text message. So that's the scary stuff. Now, let's pivot to the good news. We know more about preventing this today than at any point in human history. The medical community has adopted a new framework called CKM syndrome, cardiovascular kidney metabolic syndrome. It means we stop treating the heart, the kidneys, and weight as separate problems. They are all one connected system. The most powerful drug we have for this isn't a pill. It's a specific type of movement called Zone 2 training. You don't need to sprint until you throw up. Zone 2 is that steady, moderate pace where you can still hold a conversation, but you'd rather not. It's a jog, a brisk uphill walk, or a steady bike ride. Why is this magic? Because Zone 2 specifically builds mitochondria, the power plants in your cells. It teaches your body to burn fat for fuel instead of sugar. So when you become efficient at burning fat, you strip away the visceral fat that strangles your organs, and you lower that inflammation we talked about, and you make your arteries more flexible. 3 to 4 hours a week of this. So that's the prescription. It's the 401k for your heart. And you have to pair that with sleep. In 2026, we don't look at sleep as lazy. We know now that sleep is when your bone marrow, yes, your bones, calms down. If you are sleep deprived, your bone marrow pumps out angry white blood cells that go straight to your arteries and cause inflammation. Sleep is literally an anti-inflammatory drug. Finally, we have to talk about the worst case scenario. If you or someone you love collapses, knowing the difference between a heart attack and cardiac arrest is literally the difference between life and death. They are not the same thing. A heart attack is a plumbing problem. The blood is blocked, the heart muscle is dying, but the person is usually awake. They are talking to you, they have pain, you call 911 and you keep them calm. But cardiac arrest is an electrical problem. The lights go out, the person is unconscious, they are not breathing, and their heart has stopped pumping. And if that happens, you cannot wait. You are the heart now. You have to perform hands-only CPR, and you don't need to be a paramedic to do it. You put your hands in the center of the chest, and you push hard and fast. And to keep the rhythm, you need a song in your head. We all know Staying Alive, right? But if that's too retro for you, use Beyonce's Texas Hold'em or Dua Lipa's Levitating. They are the perfect 100 and 120 beats per minute. Don't worry about breaking ribs and worry about saving a life. If you do nothing, the chance of survival drops by 10% every single minute. If you act, you double or triple their chance of waking up. We are living in a time where heart disease doesn't have to be a destiny. So we have the technology to see the plaque before it ruptures. We have the genetic test to find the risk before it strikes. And we have the simple daily protocols like Zone 2 training and sleep that can rewrite your future. So please take this information and use it. Ask your doctor for an ApoB and LPA test. Check your blood pressure. Go for that walk. You are not just protecting a pump inside your chest. You are protecting your time with the people you love. You are protecting your future. If you found this helpful, share it with one person you care about. It might be the most important link you ever send them. Check the description for those sources. Stay safe, and I'll see you in the next one.